Taking you back now to one of our top stories, the coronavirus pandemic. The U.S. reported more than 517,000 new cases over the past 3 days alone. That puts the total since the pandemic began above 12 million people. And this comes ahead of the Thanksgiving holiday, where Americans are going to extraordinary lengths to celebrate amid the pandemic. Just take a look at these huge lines at a testing site in Los Angeles. Some people hope that they will be safer with relatives if they test negative, but experts warn that certainly is not guaranteed. So joining us now is former Secretary of Health and Human Services Tom Price. Thank you for joining us at this early hour, sir. Heading into this busy week with the holiday Thanksgiving upon us, what's your biggest concern moving forward?
Well, I think the biggest concern is that as we see this increase in volume and transmission of the disease, that we get folks together that aren't normally together, they aren't in their bubble, and you expand the number of individuals that you see during the Thanksgiving holiday, which is a wonderful celebratory time. But you may be exposing yourself to the transmission of the disease. Remember, individuals can carry the disease and not be symptomatic at all, and that's the risk in that transmission.
You know, you worked within the Trump administration, and the CDC has been very clear with its recommendations looking ahead to Thanksgiving. The CDC has asked people not to travel. AAA says upwards of 50 million people will be traveling. There has been a lot of criticism of the Trump administration that it has diminished the authority of the CDC, weakened it, even, forcing the CDC to change recommendations on their website to make them less aggressive. Do you think that this is kind of the fallout of that the CDC is asking people to stay home and clearly millions are choosing not to?
Well, I would ask folks to go to the CDC website, cdc.gov, and they've got a lot of recommendations. I don't think it's necessarily a fallout of that. I think folks just love Thanksgiving and they want to be with friends and family on Thanksgiving. And so it's hard for folks to change those habits. But it's important that folks appreciate that you need to continue to wear face masks. You need to wash your hands. You need to socially distance. And that means even with folks that you may know or are in your family, but they're not necessarily in your bubble. And so we can't ignore this. The coronavirus doesn't care whether this is Thanksgiving week or not. We do, because we want to celebrate this wonderful occasion. But it's important that you still need to be absolutely cautious.
All good pieces of advice. The Biden administration will be in charge of the response in just a few months. The Trump administration has been delaying the transition process, though. How will this affect the response to the pandemic, do you think?
Well, this is really an important question, because what happens in a transition of an administration is that there are what are called landing teams or beachhead teams that even before the new president is sworn in, they communicate with folks in a department like Health and Human Services or any of the other departments in the cabinet. And those individuals kind of get the download on information. Where are we on this issue? What have you done? What were you planning? What's the information behind that? How did you make those decisions? All of those nuts and bolts kinds of things. This is important information to pass off. Now, I don't think we're at a terribly problematic time right now, because normally this doesn't necessarily ramp up until December. But it's important that the President-elect Biden, be able to have his team, his landing team, his beachhead teams, get the kind of information on the pandemic, on other health information, and in other departments as well, so that the American people can be best served by the incoming administration.
You know, we've had some positive news about vaccine development over the past week or so. But of course, vaccines don't work unless people are willing to take them. We've seen a lot of information coming out of the Trump administration that is confusing about how you protect yourself from this virus. And we've seen some polling that indicates maybe about half of the U.S. population is uncomfortable with taking a vaccine. Now, that has been changing over the past few months, and increasingly the percentage is inching higher and higher of people who are comfortable with the vaccine. But are you concerned about some of the messaging that has come out of the Trump administration that at times questions science, and whether or not that is going to have a detrimental effect moving forward when it comes to getting people to get this vaccine?
Well, I think there's been some conflicting information in the administration. There always is to some extent, but it seems to have been greater, especially on this issue. I think it's important for folks to appreciate that the departments that are charged with evaluating the vaccine through Health and Human Services, whether it's the FDA, whether it's the CDC and the like, those individuals, those scientists, those folks will do their level best to make certain that whatever is approved for the use by the American people is the safest and most effective vaccine that can be possible. And there will be more than one vaccine, which is an exciting thing. This has happened in record time, which is really remarkable, and then folks deserve incredible credit for that. But I think it's very important that people appreciate that whatever vaccine is approved, I believe it will be as safe and effective as possible. I'm going to get the vaccine as rapidly as I can, and I would urge others to do the same. That's the only way we're going to get past this, sooner rather than later.
Oh, see, you answered my next question, which is whether or not you would get the vaccine. Let me ask you a bigger, sort of broader question before we have to let you go. Moving forward, the next administration, what do you think are the big issues that they need to tackle? You were very critical of the Affordable Care Act. You pushed the administration to repeal it. What would you like to see the next administration do to improve what it has to offer when it comes to health and human services in this country?
Well, healthcare is so personal and so important for individuals, and I believe strongly that it's important for patients and families and doctors to be in charge of healthcare, not the federal government or not insurance companies. And so we've been working on a project called Healthcare for You, and I would urge folks to go to healthcareforyou.com and see what that's all about. Instead of the government running things, we ought to be able to make it and improve the system. There are improvements that need to be made in this system, without a doubt. But it's important for patients and their families and doctors to be making these decisions. And there are wonderful ways to be able to do that. It's just that we haven't moved in that direction at this point.
Tom Price, I have like 100 other questions that I wish I could ask you, but we are more than out of time. Thank you so much for joining us this morning.
Thank you. Appreciate it. Happy Thanksgiving.